13 minutes a day is all it takes.
A meditation?
13 minutes in the morning.
Yeah.
And, I'm just focusing on this spot between the eyes. I'm just kind of, focused there with my mind. And I'm also just focused on the breath. And then if there's a bunch of noise up there, I'm just watching it bounce around. I'm not trying to control it. I'm just letting it go. Okay. Let the noise go. It's okay. Mm-hmm. And then within about 2-3 minutes or even less, the more you practice, the faster this happens. The noise just goes.
Welcome to Becoming Virtuosa, the podcast that encourages you to become your best virtuosa self. Each week, Dr. Susan Crockett goes where the scalpel can't reach, exploring conversations about how to be, heal, love, give, grow, pray, and attune. For the first time ever, she's bringing the personal one-on-one teaching that she shares with individual patients to you on this broader platform, a weekly source of inspiration and encouragement designed to empower you. By evolving ourselves as individuals, we influence and transform the world around us. Please help me welcome board-certified OB-GYN specializing in minimally invasive GYN surgery, internationally in the top 1% of all GYN robotic surgeons, a certified life coach, and U.S. News top doctor, your host, Susan A. Crockett, MD.
Patients want to know how to reduce their stress levels. And one thing that comes up a lot in our practice is about meditation and how to meditate and what that is, what it isn't. What do you tell people about that when that comes up? And what role does that play in your practice in stress management?
Well, it's really become a lot more popular, thank goodness. It's a tool.
Right.
Is how we can look at meditation. It's a tool, and it's a tool that helps to create separation between the limbic system of the brain, which is responsible for emotions and behavior.
So we call that the lizard brain.
Yeah. And so it helps create separation from the limbic system and the prefrontal cortex, where the executive functioning and thinking and processing is taking place.
Right.
And the thing that really gets most human beings, it makes them suffer the most, is they're under command and control of the limbic system.
Right.
And there's not enough space being created between their processing thinking mind, the prefrontal cortex, and the limbic system.
Right.
And so what meditation helps a person do is to create that space. There's a lot of other practices that can do that as well, but meditation is a wonderful habit to develop. And the best time to do that, of course, is in the morning, because you're going to have probably a stressful day. You go out into the world. Yeah. It's always one damn thing after another, don't you know?
It is. Yeah.
So we have to prepare for it.
So there are a couple of ways that I teach my patients to think about this limbic system and the prefrontal cortex thing. So I called the limbic system the lizard brain. That's because that's like our base fight or flight, basic reaction kind of thing. And then the prefrontal cortex, of course, is our higher brain of doing what we want to do. The one tool that we teach in the coaching circles that I run in is the limbic system is the toddler in the back seat of the car. And then the prefrontal cortex is the mom in the front seat of the parent.
Great analogy.
Because you can feel your body starting to panic or pitch that tantrum or whatever. And often, if you're aware that's just a reaction, you can feel it in your body, then you can take a second, just take a beat and think, okay, toddler, you're just doing what you're supposed to do, brain. You're supposed to warn me of things that are scary and bad and keep me safe like they did in caveman times. But, you're okay. And I'm going to make a decision to do X, Y, or Z. So that's one way that we do it. The other is in that book that's right behind you. I recommend a lot, The Untethered Soul by Michael Sanger. I really like that book because when I first started talking to patients about meditation, we live in the Bible Belt, very Christian fundamentalism type. Well, not everybody's a fundamentalist, but very, very devout Christian population. And there's been a lot of misinformation within that whole religious scene about what meditation is and what it's not meditation is actually a form of prayer. It's what we do, and we do contemplative prayer.
I was about to jump in and say, hey, Christians have been doing this for eons.
Yeah, prayer.
And so prayer is a way of focusing intention.
And beads, when people are doing the rosary, that's a form of mantra. Or, it's just helping to focus the mind. The thing that Michael Singer says in his book that I like so much is he talks about the analogy of sitting in a movie theater, where you're sitting in a chair and you're watching the movie and you get completely absorbed in it. You forget that you're in the chair. You don't feel it. You're in the movie and being part of it. But then you can step back out of it and realize, oh, I'm in the chair and I'm watching the movie. And then you're becoming the watcher of the movie instead of being the one in it.
Yes.
And so we teach our patients also to become the watcher of their brain, and being able to meditate doesn't necessarily mean you turn the movie off. It just doesn't work that way. We so often think that it means you have to turn your brain off.
That's a key point. A lot of my patients say, well, Doc, I tried to meditate and then it was just chaos.
Yeah.
Good.
That's
all. The meditation is just initially, for a lot of beginners, is just watching the noise in the brain and just observing it. Just, saying to yourself, my gosh, my mind is just full of mental noise today.
Yeah.
And that will take the noise down a notch.
Yeah.
And that makes a difference.
It does. So what that does to us physiologically is it decreases our adrenaline levels, which decreases the constriction of our blood vessels. It allows our heart rate to slow down, blood and oxygen to get to your brain so you can actually think, but it actually can help you drop your cortisol levels too.
Absolutely. So the limbic system is going to just go right over to the thalamus, hypothalamus, and boom, all of that's going to interact with the endocrine system through the adrenal glands and so forth, and the autonomic nervous system. And all those cardiovascular benefits you just mentioned, but we should also talk about the effects on the brain.
Okay.
Because we now know that for every major episode of depression or anxiety that a person has in their lifetime, there's a 13% increase in risk of dementia later in life. So a person in their 20s and 30s and 40s who's going through a lot of stress or depression, there is damage or hits being taken by the CNS, central nervous system, the brain.
Wow.
And this is, a big concern, of course, because we got all the other things that are going on with the public's health, metabolic syndrome, obesity, and that's affecting cognitive health as well. So, and then immune function plays a big role. We're talking about the microbiome, and, that last step is we want to get the stress out. We want to rebalance. Okay. How do you do that? Through exercise, through sleep, through mental health. And I put meditation under that mental health leg.
Yeah.
But you can meditate. I mean, meditation, there's a whole variety of different ways to meditate out there. Runners, long distance athletes, triathletes, they'll talk about just turning off the mind and going into a quiet, still place, a state inside of themselves.
Yep.
And so you don't have to be sitting still to do this. You can actually be moving the body. But for most of us, a meditation practice is going to, and we need something that's actionable. It's got to be doable. This is great, but it's so, I don't know where to start, so the easiest place to start is in the morning when you first wake up, before you turn on any lights, before you start making yourself beautiful for the day, is to sit still. What I like to do, I get at the foot of the bed, get into Indian style kind of, cross leg is like a kid, back straight, and I'm just going to focus on my breath. I'll take 2 deep breaths. I call it a 4-2-6 breath. I'll inhale through the nostrils to a count of 4. It's a belly breath coming from down below, and I'll hold it for 2 seconds and then exhale through the mouth completely for 6 seconds. I'll do 2 of those. Now, what's happening there, and matter of fact, you can do this any time of the day, but I'm resetting my autonomic nervous system.
That's your flight or fight versus your relaxation, sympathetic versus parasympathetic.
You have two branches. You have sympathetic, parasympathetic.
And it doesn't mean sympathetic like I have sympathy for you. No.
Sympathetic is fight or flight, right? And most people are walking around out of balance. And this is raising blood pressure, raising heart rate, raising stress, anxiety levels. I mean, just wreaking havoc on our health. And parasympathetic is the pina colada on the beach, right? And so when you take a couple of big deep breaths, you get this, and it happens within seconds.
Yep.
We had a very expensive $70,000 device that I bought 15 years ago, and we did thousands of studies, and we could just watch people go, shh, and just a couple of deep breaths.
Do you remember when you made me do that? Like, it was a year ago, almost to the day. I don't remember the exact day we did the first filming together here, but it was when we were still developing the studio, and you were kind enough to come and be my guinea pig guru. But you remember I was so wound up that day. I was dealing with the tech, and you and I had never met in person before, and I had all the food, and this stuff wasn't working, and you were like, would you just go lay down and take a breath?
Came back like a new person, right?
I did.
10 minutes, right?
10 minutes. I went and laid down and meditated for a little bit and then came back. It was like, okay, let's do this.
Complete reset, right?
Yeah. So it can happen real fast. Too.
Yeah. So most people are running around in their life like this, completely imbalanced. And this is causing all sorts of problems. We now know that this is a risk factor, a major risk factor for having a heart attack or stroke. And I'm sure there's a lot of other things that will probably go into that category. I'm sure we'll find things like malignancies and disturbance of the microbiome, of course, and then dementia. Stress it kills, right? That's the old saying. And now we know why. And some of those patients that we had them take a deep breath, guess what happened?
Nothing.
And now this means there's been damage to the parasympathetic branch of the autonomic nervous system. The sympathetic is a much more robust component of the autonomic nervous system because we basically evolved in an eat or be eat world.
Right.
You know, you had to be able to react to a threat just instantaneously. So that is more robust and can withstand the diabetes and the high blood pressure longer. Now, just to let everybody know, it's diabetes, high blood pressure, and these other conditions, smoking and so forth, that are causing damage to the autonomic nervous system. All right. The whole body's being damaged. So it's not a surprise that the autonomic nervous system is affected. With these people, we put them on 150 minutes per week aerobic exercise, zone 2, which is easy.
Being able to talk while you're walking.
Just can speak a full sentence. That's a good proxy for zone 2. And over a 6-week period, almost everybody improved. Now, not everybody got back to normal, but most people improved and other parameters improved, of course.
You know what else helps? Bioidentical progesterone.
Yes.
So in the old days when we dosed estrogen and progesterone for menopausal women, we only gave them progesterone if they still had a uterus because we were just trying to protect the estrogen from causing endometrial cancer. And that's all we thought the progesterone was good for. And now what we've discovered is if you use the actual bioidentical one, we call it the Zen hormone in our practice. It'll help with sleep and
insomnia. I was about to say sleep. Yep.
It dilates the blood vessels, decreases stress levels, cortisol levels. Yeah.
Probably what did more damage to women's health in this country, and I saw it at the moment it wasn't at the moment the study was published, but it was like a week later. The Women's Health Initiative study that was published.
In 2002.
And I can point to a handful of things, probably 5 things in my career that were just like, what? We are going way off course here.
Yeah.
And that was clearly one of them. It has caused immense harm to women.
Yeah. So just for our audience, because this is a big topic I was not prepared to get into this today. So that's true. There were a lot of misnomers from that and a lot of the things that that came out of that study that influenced how we dealt with menopause and hormone replacement therapy now has been debunked and reversed.
Correct.
For instance, one of the things in it was limiting the length of time that a woman should be on a hormone replacement therapy. So now with the bioidentical newer generation, there's not that 10-year time limit where they have to stop it after so long because the risk of heart attack and stroke that was shown in the WHO study with that was done on non-bioidentical hormones. And other big one that I heard was the breast cancer thing. So
that's right. The breast cancer incidence was very low, actually. When you looked at those overall numbers, I think there was like 8 extra cases
and
or something.
It was actually the Provera that was causing the increase. It wasn't the estrogen, even the horsemare estrogen that they were using. So there is an organization called NAMS, the North American Menopausal Society, that put out a statement in 2002 and 2023, a statement in 22 about the update for guidelines for hormone replacement therapy for women. And then last year they put out one for the non-hormonal replacement guides. And so we'll put a link for the NAMS articles there below.
Yeah, very important.
Yeah.
I saw that actually. And I was like, wow, finally, course correction. It took us 20 years.
Yeah. And it's cost lots of lives because we're finding out being able to stay on bioidentical estrogens actually continuing to reduce cardiovascular risk as we stay on it longer. And that's just the total.
And just listen, a woman's had this for decades, right? And now all of a sudden it's gone.
Yeah.
And you have all this just chaos taking place, sleep being disturbed, everything else. Yeah. And this is not, oh, honey, you're having hot flashes. No, this is a serious health issue.
Yep.
And I hope clinicians, if anybody's listening, is addressing this much more aggressively with their patients.
With the providers. Yeah. I think clinicians in my field are picking it up pretty quickly. One doctor that I recommend a whole lot, and I recommend her book, is the Mary Haver. She's in Galveston. She's a BGYN. I have never met her personally, but I just adore her writing.
Get her on the show.
Yeah, I need her. And Mary can be on the show. It'd be fun. Her book's The Galveston Diet.
Okay.
Yeah, call me Dr. Haver. Her book's The Galveston Diet. I think I heard that she's coming out with a menopause book very soon. So maybe I'll save the in-depth dive for when I get her on the show. And if I can't get her on the show, I'll figure something out. But she's a lot of fun to watch. She's very up to date on everything. And she has a menopausal clinic in Galveston. One thing that kind of hurt my feelings was she said she was having patients from San Antonio come down there. And I'm like, hello, we do have good people in San Antonio that know how to do this. But I think what she illustrated was it's hard for patients to find.
It's hard for them to find. It's like if they can find the people locally, they prefer to, of course, stay local.
Yeah.
And there are great clinicians here. Yeah. Maybe that's part of what you can put together.
Yeah.
Is on your site,
or some recommendations. Yeah. Well, and this is something that I am going to say, yes, you can come to my office for this because I've got amazing nurse practitioners that help do the hormone replacement therapy. And I focus mostly on surgery, but that's a big part of managing our patients. So
sure it is.
And that's all I'm going to say about that. So cool. All right. Where were we? What else are we going to talk about? Meditation.
Well, I think, when you get back to meditation, all right, let's just kind of, So I like to, getting back to what I do in the morning is I will, here's what the data shows. So I try to be data-driven, evidence-based driven when I can be. All right.
You give me the data, you set it up, I'll hit it and make it make sense.
So the science points the way, right? It's a tool to unveil the truth and get answers. And so 13 minutes a day is all it takes.
Of meditation?
13 minutes in the morning.
Yeah.
And, I'm just focusing on this spot between right here, right there between the eyes. I'm just kind of, focused there with my mind. And I'm also just focused on the breath. And then if there's a bunch of noise up there, I'm just watching it bounce around. I'm not trying to control it. I'm just letting it go. Okay. Let the noise go. It's okay. Mm-hmm. And then within about 2-3 minutes or even less, the more you practice, the faster this happens. The noise just goes, doo.
It does.
And it goes down. And then you kind of start to get into this almost a sensation like you're falling. Okay.
Or floating.
Yeah. It could be floating or falling. Mm-hmm. Some people freak out. Okay. Some people have a dissociation with their ego, okay, and it can be very disturbing.
Really?
Yeah. And so, if you have, that's normal too. Okay. You're not going to die. Nothing bad's going to happen.
What does that look like?
It can be a loss of identity, a sense, it's a flash of losing touch with yourself. Because most human beings are over-identified with their ego. It's the unconscious conditioned mind, as Eckhart Tolle likes to say. I think it's the most appropriate brief definition, an effective definition. And in meditation, for beginners, they will sometimes, a dissociation from ego will happen because in the meditative state, the boundaries start to go away. between ourselves and everything else. We began to realize that we're connected to everything, which is the truth.
Right.
And the ego says, no, I'm about me. Separation. It's all about me, don't you know? So there can be a little bit of anxiety.
So I like to do the drop in the ocean meditation.
Yes.
That's what I do in the middle of the night when I can't sleep, is I'm able to just pretend that I'm a drop of water in the ocean. And sometimes I float on the waves, and sometimes I drop down into the depths of the ocean or get swallowed by a fish. But it's a little bit more creative than what you're talking about, the single spot in the mind, but it works for me. And it does put me in that state of ego dissociation where I'm just like part of everything, and
you're part of the bigger ocean.
I'm just a drop in a gazillion buckets of...
And that's actually an empowering concept.
Yeah.
Because, I'm not this isolated. It's not just me. I'm connected to something vastly more powerful than just my ego.
Well, I think it's a balance, because we don't want to be ego. We don't want to be wholly without ego either. And you and I have talked about this in depth before, but I think I have some new thoughts about it. So I think it's different for men and women.
It probably is on the surface. At the end of the day, we're all affected by our physiology.
Right.
But I think even we get below that, I think it's the same. I won't defend that position, but I will say that's what I've observed. That's all I can communicate. It's what I've observed with my patients.
So what I think is that men are conditioned throughout their life to feed the ego and to have a strong ego, and women are conditioned to let go of their ego their whole life and to become disengaged from their ego to the point of codependence. And so when you start talking to people about letting go of ego, when you're talking to a woman who has no sense of self because she's turned it over to a male partner, then that's a very different conversation than when you're having a conversation with the male CEO who is head of the household and then probably needs to let go of it. So I think everything is a balance, but the more I look at those types of dynamics in people, the more I think approaching the ego conversation is different.
It is a fascinating topic. And I would just add to what you're saying is evolution is playing a role here.
Yeah.
A woman, when a female is thinking about having intimate relations with male, there's consequences. We call those children.
Yes.
And so the woman is much more invested in that act. And, you think about how we exist for eons and millions of years as hunter-gatherers. You're not going to make it as a single mom. It's going to be extraordinarily difficult.
Right.
But a clan, a partner, somebody that's there with you and invested in those children.
Yeah.
Yeah, that's a different animal. Now, that plays a role on the dynamic of the woman and the relationship with that mate.
Yes, but also the woman gives everything over to take care of her children.
And the woman has got more oxytocin, and she's a nurturer.
Yeah.
And the one thing that I have observed is that women, being just natural nurturers, and they're better at it than men, they neglect their health. Okay. And
that's my whole career, Reed. That's my whole practice.
But if you really dig deeper, if you dig underneath that, even below the surface of that, it's a form of denial and not having to come to grips with their issues and facing their pain. Because there may be a lot of pain there, and it's difficult for us to face into our pain. And the place I see this is in menopausal women or older whose kids have flown the nest, and they're still, they're following their children around all over the country, and their children are in their 20s. Right. And it's just like, wait a minute, what's going on here? They've lost themselves in that role.
So then they don't have enough ego of themselves.
And that is ego.
Right.
That's part of the ego. So it's like they're lost in the role playing. And it's an excuse when you dig into it is not dealing with their stuff. There's stuff there that needs to be dealt with.
Well, undoubtedly. Agreed. How did we get down that?
I don't know, but that's a whole nother episode.
Where I wanted to go with this talk today.
That is a whole nother episode.
But you walk that tightrope of the menopausal aging woman kind of.
I don't make the rules. I'm just a life student. That's all I am. Okay. If you say one thing, what are you? I'm a student of life.
I think it would be really interesting for us to have a discussion about the difference of the patient populations in our practices.
Oh, yeah.
Because I do think what you see in your practice is
the patterns are
different.
They're going to be different.
Yeah. All right. So what I was going to say about the ego and the loss of the ego thing, which is where this all went off the tracks, is I think we need both. I think it's balanced. Like, we don't want to completely be without an ego at all. We need to have a sense of self. And
if you look at the ego as best we can understand, we don't understand it completely, but it is a byproduct of evolution. Okay. It is all about not dying. Okay. Rule 1 is don't die. That's the first rule.
Yep.
Number 2 is have some kids, procreate. Okay.
Yep.
So don't get eaten, don't die, and have some kids. Now, both of those involve, shall we say, some can encourage some unsavory behavior, okay, that we're now becoming more aware of collectively, which is our great step that we're making as a species. We're beginning to see ourselves and this unconscious conditioned mind and how it plays out. So we're all born with this creature.
Yeah.
And it's like, okay, is it all bad? Not bad at all in an eat or be eaten world, and one in which you need to procreate. Well, we've overrun the planet.
Yeah, we have.
And we don't live in an eat or be eaten world anymore. We've changed the world. And so we're fighting our, evolution here. And that is a tall order.
Oh, I think we're transforming is what's happening.
We are transforming.
Society. And I think that's the next thing we're going to talk about is transformation and change. Thanks for joining us this week. Please remember to like, share, and subscribe. And if you have suggestions about what you want to hear us talk about again, next show, next time, later on down the line, just drop a comment for us. And hope you have a great week. We will see you next Tuesday. Thanks for joining us. Bye. Thanks for listening to this episode of Becoming Virtuosa. To learn more, come visit us at drcrockett.com. That's drcrockett with 2 T's.com. Or find us on YouTube for The Dr. Crockett Show. If you found this episode helpful or think it might help someone else, please like, subscribe, and share. This is how we grow together. Thanks, and I'll see you next week. Love always, Sue.